Hello, my name is Benjamin Michaels. I am from Glen Burnie, Maryland. I recently completed my Bachelor of Arts in Biology at Mount Aloysius College in Pennsylvania, and I've been working as a patient service specialist for NovaCare for roughly 3.5 years now. I chose physical therapy as my profession really because I've had a lot of time to think of what I wanted to do as my profession. My older sister decided that she wanted to become a professional oboe performer in her 4th grade year, and myself as the younger brother thought that I needed to know everything to do with my life at around the same time. So since then I've basically thought through a lot of my different professions that I could possibly do, and with my mother being a physical therapist herself, this gave me a lot of interaction with physical therapy as a career. And it basically made me decide that physical therapy was the career that I wanted to pursue. It really wasn't until high school when I ended up shadowing the NovaCare Glen Burnie clinic that I really truly felt that this was the job for me. Since going through the PTA program at Mount Aloysius, I really found that I enjoy the logic puzzle of using exercises, modalities, and stretching, and an overall holistic approach to health to help people with different diagnoses. Myself as a front desk worker, I've gotten a small taste of what helping patients personally is truly like. There is one patient who I specifically remember was really worried about how their insurance was going to pay for their therapy. And also they were really worried about what pelvic floor therapy really entailed, since they didn't know what that type of therapy was. Myself as a front desk worker, I helped her by letting her know what all of her options for therapy were. I told her that if she felt uncomfortable during any point of the treatment, that she had a right as a patient to deny treatment. But I also did tell her that I would give her a call back as soon as I could with a full explanation of what her benefits were for her insurance and what she would specifically be paying in the clinic. That patient's relief when she came in for her first treatment and her words of gratitude towards me is something that I really will never forget, and it helps me to want to help more patients. That patient and other examples from my work as a front desk worker really make me want to be a team with patients and help guide them to regain their quality of life. During my PTA classes at Mount Aloysius, I had classes that taught me how physical therapists see diversity within the workforce. Not only is there diversity in race and culture, but there's also diversity in their age, income levels, education, and language. I also learned that every person has some sort of implicit bias, and it may not really be what you expect. Through these classes, I gained an understanding of what my own biases are, and I have started to learn how physical therapists have to remove their bias so that they give equal care to all their patients. The state of Maryland requires that all healthcare professionals complete an implicit bias course to be licensed in the state of Maryland. And within the physical therapy clinics that I have worked, I have seen a diverse patient population and clinician workforce, and I've used my own schooling to be kind and patient to all the patients that come in. I've encountered people of different nationalities with different languages, and I've seen those therapists who work with those patients use different online interpreting systems or personal interpreters themselves to overcome this language barrier. Social justice in healthcare is extremely important for a physical therapist to be aware of. As healthcare providers, we must be advocates for both our patients on a legislative side, but also as a general resource. There are many social determinants of health that a patient may have going on while therapy is being treated. From transportation to child or elder care, to food insecurity or housing insecurity, or even just a general economic status. We as physical therapists must have a knowledge of resources where they can get help. Because even though we as physical therapists may not be able to fix the social determinants of health that are affecting their care, we still have to be aware of things such as 211 as a general resource number, language interpreters for use during treatment, or public transportation in case any of these factors are keeping our patients from getting the quality of care that they need to help return them to their own quality of life. While there are many different barriers in accessing healthcare, the barrier I have dealt the most with is the barrier of insurance. The Maryland chapter of APTA is working to pass a fair copay bill to classify physical therapy as the same rate as a primary care office visit, rather than a specialist visit, to help high copay rates not be a barrier to access physical therapy. The Maryland chapter is asking for examples of patients who have had issues with not having enough money for their physical therapy to help bring to the legislator. Myself as a front desk worker, I have a unique ability to inform the patient of this proposed legislation to help join with the Maryland APTA to help pass this bill, which I will also be able to continue as a physical therapist in the future. Becoming a physical therapist is a goal that I have pushed for most of my life. My family, friends, and my teachers have all helped me get to this point and have helped me to understand my passion for physical therapy. The patients I have worked with as a front desk worker have already made me excited to work more in depth with the patient population. Each person who notices the effort that I put into helping them, and then seeing those same patients finish their therapy and return to their quality of life, gives me so much joy. Even the little wins of a patient finally being able to reach their arm to a certain height to brush their teeth with their injured hand, or even a patient who had a knee replacement finally getting that full rotation on the bicycle, really helps to confirm my passion. My faith has instilled that all life should be cared for, and this leads me to want to be able to actively make a difference in helping to care for and advocate for all others, regardless of nationality, cultural differences, economic differences, or education. I've been taught to use my talents to provide for others who are unable to have access to these necessities. I would like to become a neurophysical therapist to help those with Parkinson's, multiple sclerosis, and other diagnoses to help ease families who are going through life-changing diseases. I have seen entire families be torn apart from neurological diseases, and by helping patients, I can also help their family as well. Seeing patients improve their quality of life, to be able to play with their grandchildren, care for their own children, return to work, and enjoy every single day with their significant others, is my goal for working as a physical therapist.